Oh, Derek Carr's in the red zone? Oh, God, he's not coming back, though.
All right, we're here today for our evaluation video of the elbow and forearm. So before we get anything going with the evaluation, I want to get a little bit of patient history to see where we're at. So who am I with today?
I am Sarah.
Sarah, nice to meet you. What sport do you play?
Play field hockey?
Field hockey, right on. What seems to be the problem that you're coming in for today?
I have a bunch of pain right here in my forearm.
Okay, where exactly? Can you point and show me a little bit?
It's like right across here.
Just all the way across the whole arm?
Mm-hmm.
Right in this middle?
Yeah.
Okay. Have you had any previous injuries to your forearm before?
No, I've never hurt this forearm before.
Okay. When did this happen exactly?
This happened yesterday when I was playing. A game at like midday, like 12.
Okay.
Mm-hmm.
Can you walk me through this scenario a little bit of when the actual injury occurred?
Yeah, so I was playing, and the person I was playing against, I was like hitting them the whole game, trying to get the ball free so I could get it. So, I mean, I did it again, and I had the ball, and I'm coming over here, right, and the person I'm playing against is right behind me. They were just kind of fed up with me, so they just took their stick and they whacked me. They whacked my forearm.
So they came across and hit down on you?
Yeah, so almost like where you're at right now.
Okay.
You just whacked my forearm.
Came down and
back.
struck the arm.
Mm-hmm.
Okay. When it happened initially, did you hear any pops or cracks or anything like that?
Initially, I heard crack.
You did hear a crack. Okay. So from there also, did you have any numbness or tingling to go along with that?
No numbness or tingling. I didn't feel any of that.
No, just pain mostly.
Yeah, just like I heard a crack and it was like a sharp pain right away.
Sharp.
It really hurt.
Okay. On a scale of 1 to 10, what would you say that pain was like?
It's got to be a 9.
9. Okay. And if that's being 10, you want to cut your arm off. Basically, you're up to a 9. Right?
Yeah, I'm almost 1 to do that.
So very sharp, very strong. Okay. Is there anything that helps take the pain away for you? Is there a position that you can keep your arm that helps it get better, or is it just kind of constant?
Just keeping it still. I mean, it hurts all the time, but if I move it, it hurts more. So
any type of movement at all is uncomfortable for you?
Anything with my hand or my arm or anything, it hurts.
Okay. So from here too, I want to conduct a little quick dash survey for the patient as part of my functional outcome measure tool. So I'm going to use that information to go along with the rest of my evaluation too. Going into some observation things, I want to know if there is an obvious deformity present that you can see.
Yeah, there's big obvious deformity.
Just right in that area where you were hit?
Mm-hmm.
Okay. No other spots on the arm?
No, just it's all just like localized right there.
Okay.
It really hurts.
Okay. Is there any edema present?
Same area.
Same right there.
Mm-hmm.
And ecchymosis as well?
Yep.
In that same area. Okay. I didn't notice you walk in or sit down, but I noticed you're just sitting pretty normally right now. Were you coming in guarding that arm particularly, or kind of protecting it to?
Yeah, so that I don't move it and it hurts more. I don't
Okay.
want to be swinging my arms or anything like that.
Definitely,
It
sure.
really hurts to move.
Okay. All right, from here I'm going to go into a little bit of some palpations. We're going to start with the patient in anatomical position. So I'm going to keep them here and go through the medial and lateral epicondyles. Any discomfort with that at all?
Not with that.
Nothing there, okay. I'm going to go right into the radius and ulna as well. So I'm going to kind of feel
that
around.
hurts right there.
That bothers on which side? Mostly the...
It's like both sides over
Both.
here.
So both the radius and ulna, okay.
Oh yeah. It's even like sensitive to touch.
Okay.
Really,
I'm gonna move.
hurts.
I'm gonna move a little more distally too to those radial and ulnar stylate processes down near the wrist.
Yeah, I can still feel that like back in here when you.
Okay.
When you.
Not too uncomfortable down in this area though.
It's not as bad, but I can still feel pain
Mostly
right
up
here. Yeah.
Okay. All right. I'm gonna let you rest it right here again. So from here, also I want to check the radial pulse and capillary refill for the patient, make sure that they're getting proper blood flow to that site. So I'm going to hold you here just to support. We'll check your radial pulse. Good, that's normal and present. We'll check the capillary refill, and that is within normal limits as well. Now I'm going to go right into some special tests. I am suspecting at this point, based off what information I have from the patient, that there is a possible fracture present. So I don't want to conduct too much movement or too many tests to make the patient even more uncomfortable than they already are. But I am going to go right into a tap test to rule out a fracture for sure. So I'm going to support you here. Let me know if you feel anything uncomfortable or shooting down in that area.
Oh yeah, right there.
That hurts?
Mm-hmm.
Okay.
Sharp pain, it hurts.
Okay. Also, I will just check some general strength for the patient. Bilaterally, I'm going to have them squeeze my fingers and kind of see what the function is like in their hands and in their wrist and forearm muscles in general in that area. So I'm going to have you just hold your hands up like this and squeeze both of these fingers for me.
Yeah, it's hard to even squeeze because of the pain.
Okay. So there is a clear difference in strength right now. Obviously, the right side is much stronger than the left that's affected currently. Really, I don't need to go through much else to realize that there is a fracture present with the obvious deformity. So I don't want to put the patient through any range of motion necessarily to make them more uncomfortable or painful for the area. So right now, I am just gonna, refer to a physician after I've splinted the area and kind of made the patient comfortable in the position they're in. Any sort of ibuprofen that might help, a little bit initially, or ice to the area could be recommended as well. But we will splint the area right here to protect, and we're going to refer this patient to the hospital and a physician immediately for x-rays, just to make sure 100% there is a fracture present. So until then, there's not a whole lot else we can do, but we will carry on with treatments once we get a final decision with that imaging. But at this point, the evaluation is complete. So, thank you.